Welcome to GCTE Center's Lesson of the Week. My name is Mr. Grant, and I am the instructor and navigator for this week's lesson. The ASHE Basic First Aid Training Program is intended for individuals who are not healthcare providers or professional rescuers, but desire or are required to be certified in basic emergency medical care. There are no class prerequisites. The goal of this training program is to help students develop the knowledge, skill, and confidence to respond in a medical emergency, founded in the basic principles of instructional design and learning theory. Week 1, First Aid Provider Introductory Lesson. Why this topic matters. When a medical emergency occurs, a trained first aid provider can protect or save lives prior to the arrival of emergency medical service personnel. What students should learn. After completing this lesson, the students should be able to state or identify the following: how to recognize an emergency, the priority of personal safety, and a basic intro to chest compressions. Recognizing emergency. Before helping as a trained first aid provider, you must be able to recognize that a medical emergency exists. Often, emergency situations are unexpected events and can be confusing. A general impression is a quick sense of what has occurred or is occurring when you first observe an emergency scene. This impression can provide important clues to help guide you as you continue. Some of the questions you should ask yourself is: where is the person located? How is the person's body positioned? Does the person look sick or injured? Is it safe for me to be here? Recognizing emergency additional questions. Does the person appear to be unconscious? A person who is not moving and appears to have collapsed could have experienced a sudden cardiac arrest. You could be the person's only chance for survival. If you suspect an injury, how do you think it happened? Injuries occur due to physical force against the body. The manner in which that force creates an injury is called the mechanism of injury. Mechanisms that transfer significant force are best assumed to result in serious injury until proven otherwise. Personal safety. Emergency scenes are often unsafe. Your personal safety is the highest priority, even before the safety of an ill or injured person. Putting yourself in danger to help someone can make the situation worse. Always pause for a moment before approaching. Look for obvious hazards. Consider the possibility of hidden dangers. If the scene is unsafe, don't approach. If your current location becomes unsafe, get out. A good acronym to remember is SETUP. SETUP is a numeric device that can help you remember the important points of making sure it is safe to provide care. For SETUP, the S stands for stop. Pause to identify the hazards. E is environment. Consider your surroundings. T is traffic. Be careful along the roadways. U is unknown hazards. Consider things that are not apparent. P is for personal safety. Use personal protective barriers. Here at GCTE Center, our students are going to demonstrate that.
Until you, all right, go.
Walk up, see if it's safe, give out cards and water, so follow them, look, and go.
Primary assessment of an unresponsive person. The primary assessment is a simple way of quickly identifying a life-threatening condition is present. It is the initial approach to anyone suspected of being ill or injured. The steps of a primary assessment are always the same. If it is safe to provide care, check for responsiveness. If unresponsive, activate EMS and get an AED. If one is available, check for normal breathing. If you determine a person is unconscious, send a bystander to activate EMS and get an AED. If you're alone, do this yourself and quickly return to the person. When alone with an unresponsive child or infant, provide about 2 minutes of CPR before leaving to call for EMS and get an AED. If you have a mobile phone, use it to activate the EMS. The speaker function will allow you to follow instructions from an EMS dispatcher while providing care. To check for normal breathing, quickly look at the face and chest. Take no longer than 10 seconds. Normal breathing is effortless, quiet, and regular. If you are unsure, assume breathing is not normal. Weak, irregular gasping, snorting, or gargling sounds can occur early in cardiac arrest. These actions provide no usable oxygen. This is not normal breathing. If the person is not breathing or gasping, perform CPR. Begin with chest compressions. When an unresponsive person is breathing normal and uninjured, place him or her on a side laying position to help protect the airway. Here are the steps for a primary assessment of an unresponsive person. First, assess the scene. Pause and assess the scene for safety. If unsafe or becomes unsafe at any time, get out. Check for response. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If unresponsive, have someone activate and get an AED. Look for normal breathing. Position person's face up on a firm, flat surface. Look at the face and chest for normal breathing. Take no longer than 10 seconds. If unsure, assume breathing is not normal. Now, the students of GCTE Center will demonstrate this also.
Hey, no, talk to him. You alright? You alright? Talk to him. You alright? You alright? You alright? Are you okay? You alright? You okay?
Chain of survival. Sudden cardiac arrest can strike at any age but primarily affect adults. The chain of survival is often used to describe the best approach for treating sudden cardiac arrest. Each link in the chain is essential for a person to survive. If a single link is weak or missing, the chance for survival is greatly reduced. The greatest chance for survival exists when all the links are strong. Important points: early recognition of cardiac arrest and activation of EMS, immediate CPR with high-quality chest compressions, rapid defibrillation or electronic shock to the heart, effective basic and advanced EMS care and transport, effective post-cardiac arrest care at a hospital. Calling for help. An essential role of the first aid provider is to recognize when additional help is needed and knowing how to get it. This includes learning how and when to activate the EMS system, using the emergency action plan in your workplace, and how to contact your local poison center. Emergency medical services describes the pre-hospital emergency medical response system developed within a community. An EMS system uses specialized emergency communication equipment to gather information and dispatch appropriate emergency resources. Trained EMS provider within the system respond directly to the emergency scene, provide advanced medical care, and transport ill or injured people to a hospital. Now, the students of GCTE Center will demonstrate this also.
All right. You okay? No pulse. Yes, I have them right here. I'm gonna went to Paper Bell at GCTE Center. Someone there, they have no pulse. Put it on speaker.
Chest compressions. External compressions of the chest increases pressure inside the chest and directly compresses the heart, forcing blood to move from chest to the lungs, brain, and the rest of the body. Quality matters. The better you compress, the greater the influence of survival. Focus on high quality techniques. Good techniques to practice is compress deeply, more than 2 inches. it is likely you will not compress deep enough. While injury could occur from deeper compressions, do not let the fear of this affect compression depth. Compress fast, between 100 and 120 times per minute. Do not let a higher compression speed result in shallower compression depth. Allow the chest wall to fully recoil or rebound between compressions. Avoid leaning on the chest at the top of each compression. When compression properly, you may hear and feel changes in the chest wall. This is normal. Forceful external chest compressions may cause chest injury, but are critical if the person is to survive. Reassess your hands position and continue compressions. Now, the students of GCTE Center will demonstrate this also. This week's lesson, we talked about the introductory for first aid provider and introductory to CPR. Stay tuned to our next week lesson in reference to rescue breaths, recovery position, and basic first aid.